Hey, it's Ryan Reynolds, and I'm here with Keith, co-star of my upcoming film, If, only in theaters May 17th. Do you want to tell people the big news? All right, I'll do it. Sign up now and you'll get unlimited for $15 a month and 6 months of Paramount Plus Essential Plan on us. MintMobile.com/switch.
Upfront payment of $45 equivalent to $15 per month. Unlimited over 40 gigabytes per month. Face lower speeds. Videos at 480p. Active Mint customers by 531.24 get 6 months of Paramount Plus Essential Plan. Auto renews after 6 months. Offer ends May 31st, 2024. Separate Paramount Plus registration required. Terms and conditions apply if rated PG.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steyer, a public health scientist, and today I'm joined by a very special guest, my amazing husband, Dr. Ethan Chapin, an emergency physician and medical director of urgent care and occupational health. All right, today we are going to talk about stitches. The clock is ticking, so let's get to it. All right, Ethan. So when should a parent bring their child to the ER for a cut or laceration versus trying to manage it at home?
There's no perfect answer for that. You might try to handle small or superficial cuts on your own at home, meaning if you can't really spread it open, you don't see tissue layers or fat or muscle, in that cut. And especially if it's somewhere where there aren't any potential cosmetic concerns. So facial lacerations we see frequently, even if they're minor, just because there is the concern for appearance and cosmetics, appropriately so. But the first thing you can do when you see the injury is make sure that there's no more significant injuries that you've missed, and don't focus on the bleeding and miss a head injury or loss of consciousness or something like that. And if there is a cut or a wound that is bleeding, make sure that you apply the basic medical techniques of compression to the injury to stop the bleeding. Try to get something clean on it, elevate it above the level of the heart. And you can apply some cold or ice to help compress to constrict the blood vessels, and that can help with some pain control as well.
So should parents attempt to clean a wound before coming to the ER? And if so, what's the best way to do it to minimize the risk of infection?
Absolutely, you should. The best thing you can do to minimize the risk of infection is prompt irrigation. And it doesn't have to be sterile fluids. Really, tap water is clean enough. There have been studies that show the risk of infection is not any greater with tap water as opposed to sterile saline, for example. Really, the factors that are going to impact the risk of infection the most is duration of irrigation and pressure of irrigation. So if you throw the injury under a fast, wide open faucet, cold water, and for 10 to 15 minutes, you are really minimizing the chance of developing infection there. That's all if your child tolerates it. And if they don't, that's why we're here.
All right. So what are the different types of stitches or closures used for kids, and what factors determine which one is best for a particular wound?
That's a good question. There's actually many options. We think of stitches or sutures, and that could be different materials that we use, from absorbable to non-absorbable. We can even use staples sometimes in specific injuries. We have glue available. We have butterfly strips or steri strips for skin closure. Really, the thing that's going to make the factors that we use to determine what we're using to close the wound is location and really extent of the wound. So if it's a simple laceration, it's small, it's not deep, it's not bleeding, and it's somewhere on the extremities, we're going to use glue 90% of the time. We can use steri strips even, or a combination of the two. For anything that has the risk of opening up on its own, if there wasn't a more secure closure, so this is the areas around the joints where the skin is stretching more, or if we're worried about cosmetics like on the face, you're very likely going to get some stitches. Although, again, you can use glue on the face. It's perfectly fine, and the risk of cosmetic outcome it really isn't that much less. It's going to depend on the depth and size of the wound more than anything.
All right, last question. Are there any specific concerns or complications that parents should be on the lookout for after their child has received stitches?
Infection. So you're going to get the return precautions. We're gonna try to tell you about the red flag signs and symptoms for infection, and it's pretty basic. I mean, it's what you would expect. Doesn't have to be too complicated in your head. You're going to look for increased pain, increased swelling of the wound, any spreading redness, any increased warmth, or any pus or purulence that starts to leak from the wound.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you like this podcast, can we recommend another one? It's called Big Picture Science. You can hear it wherever you get your podcasts, and its name tells part of the story. The big picture questions and the most interesting research in science.
Seth and I are the hosts. Seth is a scientist. I am Molly, and I'm a science journalist. And we talk to people smarter than us, and we have fun along the way. The show is called Big Picture Science, and as Seth said, you can hear it wherever you get your podcasts.